for anyone joining us today or listening in, this is our second Instagram Live. And this is when I quiz Laura, who is the founder of the Ozone Clinic, on something specific. We're choosing certain topics each time we do one of these, just to try and explain it a little bit more and answer any questions that you may have. So we're all going to talk about Ozone Active today, Laura.
We are. Ozone Active injections.
Yeah. So should we start off then? Can you just explain what Ozone Active is, please?
So Ozone Active is based on Prolozone, which was developed by Dr. Schallenberger in America. And he mixed some homeopathic anti-inflammatory nutrients with ozone. And what we've done is we've increased the homeopathic side and mixed that with ozone to call it Ozone Active. And what we use that for is for injuries and chronic pain. And now basically anyone that has an injury or arthritis or anything that has caused them inflammation or pain within a joint, then and it hasn't repaired or recovered in the normal process, will then become chronic. And this is when the body basically has not switched off the immune response, and it keeps sending messages down to keep it inflamed, to send messages from the brain to say that it's still painful. And it can also, there is wear and tear that is happening, so cartilage, especially when there is arthritis, can be worn down. And so what happens is that there is poor circulation to these ligaments and joints, so it's not getting the blood flow that it needs and the oxygen that it needs to heal effectively. So aging also further decreases the circulation and oxygen utilization, and trauma basically produces inflammation. And then the cells start to kind of lose their energy and efficiency at repairing, as well as getting stuck in this chronic inflammatory painful response. So what we do with Ozone Active is that by injecting ozone, which is the supercharged oxygen, it breaks the cycle of the inflammation. It sends oxygen to the area and it promotes healing. So it promotes collagen and elastin growth and regrowth and healing, and it also initiates anti-inflammatory responses by breaking that cycle and sending messages to the immune system that this area doesn't need the inflammation because it has enough oxygen, it has enough nutrients, and it's getting fixed.
Yeah, so I mean that's quite a complex thing that's going on there, and I think over time we'll be able to explain more and more what pain is and how actually it is caused sometimes, and how, you know, we feel it's very localized, but actually quite often pain, you know, is linked to our heads and our brains and our nervous systems and so much more. So really, Ozone Active is great. It's really targeted, isn't it, Laura? Targeted injections, as Laura said, into an area, particularly joints, but it can be muscular, that have suffered some sort of trauma or injury, or you have chronic pain, or it's general wear and tear or arthritis. So yeah, so you've explained how it relieves the pain. So you basically inject it into the joint, and it's a gas, isn't it? I mean, can we just explain how that feels? Because I mean, I know what that feels like, but you are injecting ozone as a gas, aren't you, into those joints?
So it can feel, because it's filling up, as it gets injected into the body, it does expand because it's a gas. So it then fills that area, and you can feel like a pressure when it is injected into the joint or the area that's being treated. And it does feel, it's not necessarily painful. It can be a little bit painful on injection, but that pain goes away very quickly. But it's just a feeling of fullness because it is filling the whole area. And we also know that within joints there's gaps, they're kind of nice dark areas where like bacteria and viruses like to get in and hide, which can also be a result of an injury. And by injecting ozone, which will kill bacteria and viruses on contact, it can help to reduce that, which is also causing inflammation.
So I mean these ozone active injections are brilliant. I mean, so many of us, I think, and a lot of people relate to this, and it's not just as you get older, but you've got it, your elbows ache, you get tennis elbow, or you do something, your shoulders, your knees, your hips. And these targeted injections are amazing. I mean, they are totally amazing. We have some great stories. Do check them out on our website. I mean, people who have really struggled walking have a course of these injections and they can't believe it. Not just are they walking, they're probably skiing and doing all these incredible things that they didn't think they could do. But also the top athletes, we know people suffer, the better you are almost and the more honed your body is, you're likely to suffer injuries. And these kind of injections make it much quicker, don't they, Laura, for your body, not only to repair, but to recover. So you're not losing precious training time or anything like that.
We know that increasing stimulation, circulation and blood flow improves the oxygen utilization. So that improves the oxygen that gets to the area, and we need the oxygen to produce the energy for healing and repair. So it reduces that free radical reactive oxygen species that are released during repair as a repair process, and it decreases the inflammation so that it just allows the body to heal more quickly.
Yeah. So should we just share like a few examples of perhaps, without giving any names away, but people that you've treated or that we know people doing certain things can help alleviate? I'll let you go first.
Yeah, we've had clients that, a young client in particular who tore his ACL ligament and had an operation on it, but that operation had failed, and he was really at his wit's end because he couldn't run, he couldn't play football, he couldn't do any of the normal things you want to do in your 20s, and his only option left was knee replacement. And so he came to us and I gave him a course of 6 injections, and he has now seen huge improvement, and he's able to run, play football and do everything that you would want to do, and has prevented himself from having to have a knee replacement operation.
Yeah, and that goes for people that possibly might have to have hip replacements. Anything like that. We know people struggle really with shoulders. That's not an operation that is so widely done anymore, and it's done at the moment and is quite complex. So having a course of these injections could really mean that you never even have to consider surgery.
It would certainly reduce the likelihood of you having to have surgery, or delay your time and prevent you having to have it in the near future, especially for arthritis and the elderly. That would definitely delay the need and keep you mobile and keep you pain free, so that you can, which is really important for your mental health as well, and so that you are able to be self-sufficient.
Yeah, totally. And I think that flexibility, and just like people to realize that, you know, these injections, they can be in your neck, in your spine, in, as Laura said, any of your joints, in cartilages. They really are, you know, they can be. You would speak to Laura, she would work out exactly what you required and then be able to decide where you needed those injections. So talking about that, Laura, could you just talk us through what an average treatment, say it was someone's first time coming to you, what that might look like?
Okay, so we would do a consultation where I sit down and ask you lots of questions about how you came to be where you are now, previous injuries or age-related wear and tear, what kind of work you've done, what kind of, do you have, are you eating inflammatory foods, for instance? So we look at it as a whole, then we assess movement and your ability and your range of movement, and then we work on improving that range of movement and also supporting the whole body by recommending, you know, foods that may be causing to avoid the foods that may be causing inflammation.
Okay.
And also we'd look at nervous system and past traumas. Has it been caused by car accident, or, you know, something that has put the nervous system into an upregulated, more hyper alert kind of phase, where we have to then work on that to calm that, as well as giving you the injection.
Yeah. So, I mean, I think that just reiterates that everything at the Ozone Clinic, basically we stand for, is functional medicine, and it's all about prevention and regeneration and elimination. So as Laura says, everything is looked at a whole, but on a holistic and cellular level, before we administer any kind of treatments or recommend any treatments. But I think on average it would be about, your first one would be about 90 minutes, am I right, Laura? So you'd have your consultation, and then obviously Laura would work out and recommend where those injections needed to be. And we won't discuss this today, but you also get another little treatment called a PEMF, and that really enhances everything that we do. So as I say, it's not always just, you don't just go in and have one thing. It is a completely holistic approach. So Laura, let's just remind everyone how they can find you and contact you.
Okay, so you can contact us via the website, and info@theozoneclinic.co.uk, or you can call us on 01962 217 110.
Brilliant. And seriously, I mean, these Ozone Active injections, they really do stop pain. That's what it's all about. They give you mobility, flexibility. It's really important, and also great maintenance if you're out there and a serious sports person. And you mustn't forget that, you know, Laura's available. We do offer 15-minute free calls, which you can just book through the website. You can also sign up to our newsletter, which we send out every couple of months, so we're not bombarding you, but that gives you a bit more insight into what we're doing, updates, science news, that kind of thing. And please, I mean, anyone who's joining us today or listening, hopefully they already follow us on Instagram or Facebook or LinkedIn. So thank you, Laura. Thank you so much. Ozone Active. And I just want to say that please tune in on the 17th of May. We're talking about a very exciting new treatment that isn't hugely available out there at the moment, but we are starting to offer this, and it's called high dose IV ozone therapy. It's very, very exciting. So join us in a couple of weeks and we'll be talking a bit more in depth about that. So thank you, Laura.
All right,
no questions today, but there might be some more another time.
All right.
Bye.
Bye.